metronidazole. What is its mechanism of action? It forms free radical toxic metabolites in the bacterial cell wall that damage DNA. It is bactericidal and also anti-protozoal. Mechanism of action, very important. It's used to treat Giardia, Entamoeba, Trichomonas, also Gardnerella vaginalis, and anaerobes like Bacteroides and C. difficile. It can also be included in the treatment for H. pylori infection, included as part of the triple therapy with a proton pump inhibitor and also clarithromycin for the H. pylori infection. First aid has a mnemonic for the student to help remember these by get gap. It's one that the book uses to help the student remember the organisms that metronidazole is used to treat against. I believe the mnemonic was something like get gap on the metro with metronidazole. Okay, so let's take a look at some side effects of metronidazole. A really high yield one is the disulfiram-like reaction, RXN for reaction, when taken with alcohol. Now you might be asking yourself, okay, well, what does that disulfiram-like reaction encompass? It includes things like severe flushing, tachycardia, so an increased heart rate, and also hypotension. Not hypertension, but hypotension. These things are seen with the disulfiram-like reaction. Some other side effects can be headache, and the patient can complain of a metallic taste. These can be mentioned in the clinical vignette. The one thing I do want to mention about the treatment for anaerobes is that this is for the treatment of anaerobes typically below the diaphragm. So we covered a lot of high yield stuff about metronidazole. And remember that this is for USMLE board review purposes only. Just a medical student doing some review.